Mr. Speaker, our healthcare financing system in America is broken. We have the best healthcare system in the world, but the financing system is going to degrade and it's going to wreck the quality of healthcare if we don't do something about it. I come before you this evening and talk about this issue. There's a vital importance to everyone in this body and every American, and that is healthcare. The new administration has stated that healthcare reform is going to be their main priority for the rest of the year. And I applaud the administration for undertaking this ambitious endeavor to finally reform this broken system of healthcare financing. Our current healthcare system, with the reliance on third-party or employer-provided insurance, is a relic of World War II. As time marches on, we are finding that individual patients, which should be the primary concern of any healthcare system, are being relegated to the back seat in the decision-making process, leaving it up to their physician to try to obtain payment from insurance providers with varying degrees of success. In fact, insurance bureaucrats, both government and private, are currently making healthcare decisions and are already rationing healthcare. And these folks are not even medically trained. Instead, if true healthcare reform is to be at all successful, we must refocus our efforts on putting patients front and center of all decisions that relate to their health. The patient and the physician should be deciding the best course of action as it relates to the patient, just as the patient should be the main arbiter with their insurance provider. Once people are finally allowed to assume responsibility for their own medical well-being, they will be able to demand up front explanation of charges for potential tests and procedures. Only in a fully patient-centered system can we bring the market forces of accountability and transparency into the healthcare system that exists in other areas of our economy. I envision a way in which we can build a vibrant healthcare system in our country, where physicians are free to practice medicine without the massive government burdens that our current healthcare system weighs them down with. Our new system will still have a vital place for a third-party payment structure to cover extraordinary or even catastrophic procedures. But the basic tenet must be simple and straightforward. The patient must always come first, and the patient must ultimately be responsible for their own healthcare well-being. The task set before us is enormous, but it is attainable. Failure is not an option, but a fate worse than failure is the future of our country and its people, is absolutely making the wrong choice. I cannot stress this enough. Our country's healthcare system must not follow the ill-advised example of other Western countries, specifically France, England, and Sweden, with an utter reliance on the government to provide health care for every individual. This is socialism in its most basic form, and is directly responsible for burdening these countries with such massive financial obligation that the only remedies are radical changes and cuts or bankruptcy. Not to mention that the standard of care in these countries provide is an inferior one. True, our current healthcare system is rapidly going bankrupt and bankrupting every American in the process. But we spend 2.5 times more money than any other country in the world right now. Just imagine how we'll spend if we follow Europe's lead and totally socialize our healthcare system. So we must not follow their reckless example as we work to change our own healthcare financing. But we must not waver either in the face of this enormous task set before us, and make no mistake about its enormity. I've never encountered a problem, except for national defense, where a solution from the government has turned out better than a solution from the private sector. That said, we should not stand for trading in government bureaucrats for insurance company bureaucrats. I cannot stress this enough. The ultimate decisions must be in the hands of every individual patient. Physicians should be in charge of explaining the benefits and risk of each and every test and procedure to the patients, and the patient will decide how to proceed. When necessary, the patient will consult with their insurance provider, seeking guidance about extraordinary procedures or hospital stays or whatever is required. We must make steps to change our healthcare system, but socialism is not the answer. Let's work together to find solutions that's patient-focused and not government-focused.
Gentleman's time has expired.